Hello again and welcome. I'm Dr. Vyas with New Wave Wellness Center. And in this video, I'm talking about something which, if you're a patient in my office, you've heard me ask a lot of times, how much water you're drinking. So I'm going to talk about water, why exactly we need all this water, and how much you need to be drinking in a day just to get enough in your body. All right, so let's start with this. If depending on your age, your sex, your location where you live, and your body size, you're about 60 to 70% water, which means your body contents, everything in your body is about 60 to 70% water. Now, the water in our bodies helps not only regulate your body temperature, but helps lubricate your joints and is also nourishing for your brain and your spine. You've heard of the cerebrospinal fluid and all those things. So very important for those kind of things. Now, organs in your body, your brain and your heart are about 3/4 water. So that's about the same amount of moisture as you find in a banana. Your lungs are about 83% more water in it. So it's about, moisture content of an apple. And even your bones, if you think your bones are just dry and brittle or something that way, your bones contain 31% water. So each day you lose about 50 to 60 ounces of water just from things like respiration, like when you breathe, all the moisture that's coming out of your body, your sweating, your bowel movements, all this we lose about 50 to 60 ounces of water in one day. So you got to replenish that. That's one of the big reasons why we talk about you need to put that water content back in your body. Your body needs that water. So if you're dehydrated, what happens is your brain senses this dehydration and it'll signal something called your antidiuretic hormone. This goes down into your kidney because we know the kidneys regulate your pressure or your water content in your body. So it'll signal the kidneys to absorb more of that water. And that's what the reason is why you end up with that dark colored urine. And that's why I think, you may have heard a lot of people talk about how one indicator of finding out if you're dehydrated or if you need to be drinking water is the color of your urine. So yes, if you're dark colored urine, if it's very bright, dark yellow or something, that means your body is absorbing as much water as it can. So it's throwing out a very concentrated urine, and that means you need to be drinking more water. So again, if your urine color is very light, it's a little bit lighter yellow, that means you have got enough water content in your body. Now, the big thing when I talk about the kidneys and your brain and all these things, your kidneys regulate not just your water content in your body, and because they do that, they actually regulate your blood pressure. We'll talk about that in just a little bit right now. So again, with water content in your body, water governs so many different processes in the body. Your energy levels, your moods, if your skin is dry or not, even your cognitive function. Your brain, if you're dehydrated, your brain kind of almost has to work twice as hard as a normal hydrated brain to just finish a task. So again, sometimes, when you're dehydrated, you may find yourself kind of sluggishly suffering to kind of finish a task that you need to. Well, that's where this guy comes into play. So just drink a little bit more water and you'll see what happens. Now, there's also something, if we talked about dehydration, there's something called overhydration. It's almost very rare. Nobody's sitting around chugging down bottles of water, but what can happen with overhydration is when you drink too much water in a very short period of time. Now, a lot of times athletes, people that are involved in certain kind of sports or activities, do end up with something called overhydration. This is, again, just as bad as dehydration. Overhydration can be bad as well. But we know. Now, what do we mean by overhydration? Well, conventional sciences and studies say that you need about 8 glasses of water a day. We've all heard that, right? You need 8 glasses of water a day throughout the day to kind of maintain your body. Well, their new studies have shown that there's a lot of different factors that are involved in that. You don't need just the 8 glasses of water. Depending on where you live, depending on your body size, your composition, your age, your health, you need a specific amount of water. Now, you've heard me also talk about how they say it's half your body weight in ounces of water in a day. Yes, that's what your body's requirements are for one day. So if you weigh about 180 pounds, if that's your body weight, you need about 90 ounces of water in a day. Because think about it. We talked about how you lose about 50 to 60 ounces of water in a day just from your daily processes without even trying. You're losing 60 ounces of water. So if you're not replenishing that, what happens? Your body's always in that state of, oh, we need more. So it's about half your body weight in ounces of water in a day. Again, the way I said, it depends on people's health levels. Now, you don't want to be starting to drink half your body weight from tomorrow. I always mention that. It's going to really shock your system. You're going to end up going to the bathroom like every 2 minutes and you're going to blame it on me, so let's not do that. So start off very slow. If you're drinking only about, one of these bottles is 16 ounces. If you're drinking 2 or 3 of these bottles a day, start off with about half more the next day. You increase it by a half for a couple of days, let your body adjust to the change in water, and then you keep going up more. So that's how you can reach about half your body weight in ounces of water in a day, is what your body needs. Now, you can also get water from a lot of the foods we eat. If you're eating enough certain fruits and vegetables, they contain a lot of water content to them. Your strawberries, your cucumbers, melons, things like those. Yes, there's a lot of sugar content to those too, but again, if you're getting some of those in here, they say about a fifth of your water intake comes from foods that we are eating, right? So if you're eating some of those kind of fruits, especially now with the weather changing, we are seeing more of the fruits and veggies. We'll lean towards more of that because you can get a little bit more of your water through your foods as well. So you don't need to be chugging down bottles of water. Now, staying hydrated, as I just mentioned, is very important, right? We talked about all these processes. There's tons of different things that drinking water can help. As I talked about, I was just talking about how your kidneys regulate your water in your body. Well, your kidneys also regulate your blood pressure. So anybody that's hypertensive, you have high blood pressure and all that, listen to this. When your water content in your body is low, what happens? The blood that's circulating through your heart and through your body gets a little thicker. So what does the heart have to do? It has to pump it a little harder just to get that sludge moving around your body. And what is that going to do? Increases your blood pressure. Well, if you drink enough water, the water gets the blood gets thinner. Again, kidneys are regulating that, so your blood gets thinner. And what happens? Your heart does not have to pump as hard, and so your blood pressure kind of goes down. So simple trick: drink a little extra water if you have any hypertensive issues, and you'll notice your blood pressure drop. So that's one of the big things. Now, water also helps flush a lot of the toxins out. That's one of the big things we also talk about in our office, like after an adjustment or after certain times when you've had a massage, they always mention that you should drink some more water because it helps with what we call the lymphatic system. It helps flush all those toxins and the waste out of your body. Water also clears your complexion. So if you're suffering from any kind of thing going on, rashy skin or complexion is not as good, drink some more water. It'll clear up your skin. It's really good for that. It regulates all your system also in your body. It also helps in weight loss. You've heard of that a lot of times, right? People say that just drinking water can aid in weight loss because it helps increase your metabolism. Sounds kind of crazy, but it does. So water is like the miracle liquid. You need to be drinking a lot of that. Now, there's also been research that has shown that people with heart disease, cancer, diabetes, strokes, certain things this way have been helped with just increasing water intake in their body. Right? So a simple fix to a lot of different complicated problems is this tiny little clear liquid that we talk about. Now, so I hope this helps, and I know a lot of my patients, as I say, you've heard me talk about, drink your water. Well, now you understand why I'm talking about this thing, because water is very important. It also help your muscles and all these things stay more flexible or elastic, recover from injuries and anything a little better. So water is water, no substitute. You can drink some coffees and teas and all that stuff. There's nothing wrong with that, but you got to replenish that with some water as well. So, there's some teas, your herbal teas and all that are totally fine. That could be your water intake, but when you drink anything with caffeine in it, caffeine dehydrates the body. Alcohol dehydrates the body. So if you're drinking any of those, you need to replenish your body or replenish your water intake again and see how you feel. So I hope this answers a few of the questions about water and why I keep pushing the water. And if you have any questions or any comments, please post them below. And I'll see you in the next video. Thank you.